Good morning, good day. This is a little difficult subject. Everybody knows about the clinical part, but when it comes to, digging deeper into the anatomy and the physiology, students find it a little difficult. So there were some students who had particularly asked these questions, especially when they come in MCQs. Because in MCQs, the objective is to dig deeper into the problem, not like your bedside rounds. They would just ask what is the difference between centralization of pain in the appendix and localization to the right iliac fossa. And they just keep quiet after that. They don't dig deeper. But when it comes to an MCQ, they'll dig deeper into the neural connections. So some students wanted me to make a small presentation on this, taking the clinical findings along so that when they are finally giving their MCQs in the NEET, they have an idea about both the applied anatomy and the clinical aspects, and it's easier for them to get the options right. So it's about the anterior abdominal wall. We are not going to go into the detailed anatomy of the anterior abdominal wall. I'll be trying to only solve some MCQs which have been coming in the exams. The questions were largely what are the nerves supplying the abdominal wall, what are the nerves supplying the viscera and the abdomen, and this is pure recall. There is no much concept here, and this loss of liver dullness. Actually, these questions are probably from Bailey and Love because the subject matter is in Bailey and Love. So the answers are based on the subject matter in Bailey and Love. The following statements regarding nerves responsible for abdominal pain is true. The abdominal pain, the pain can be originating in the viscera, it can be originating from the anterior abdominal wall, or it can originate from the viscera and then later on affect the parietal peritoneum. Your parietal peritoneum, as far as nerve supply is concerned, belongs to the anterior abdominal wall. So if you remember this, you will also understand why in appendix the pain is central around the umbilicus and then it localizes to the right iliac fossa. We'll come to that later. So the abdominal wall is supplied by the hypogastric and ilioinguinal nerves and the lower two intercostal nerves. If you see this question on your system, you'll be able to make out that from T7 onwards, the abdomen starts getting supplied. So from T7, that is the lower 6 intercostal nerves will be supplying. So if you look at the xiphisternum of this chap, it will be supplied by T7, and the ilioinguinal and ilioinguinal nerves will be closer to the iliac crest. So you must understand the lower 6 intercostal nerves are supplying the abdomen also. So this is not true. Coming to afferent impulses from the viscera is carried by the sympathetics. Let's have a look. Afferent impulses are from the viscera. We are not talking of the abdominal wall. Here it is showing hand, but it's the abdominal wall also, which is a somatic part. Afferent impulses, pain impulses, are always carried by the sympathetics. So this answer is not right. Afferent impulses from intra-abdominal organs is carried by the parasympathetic nerves. No, the efferent impulses coming from the hypothalamus onwards to release the hormones, efferent impulses to release the secretion of the ducts, they are all coming through the parasympathetic. So afferent is carried by the sympathetic nerve and efferent is carried by the parasympathetic nerve. This much you must know. Afferent impulses from the visceral peritoneum is represented well in the sensory cortex. This is wrong. When it comes to the visceral peritoneum, the impulses that are going from there to the cortex not well represented. That's why visceral pain, patient may not be able to tell you exactly where. But the moment it is a parietal pain, he'll be able to point and tell. Suppose he has a hematoma of one quadrant in the anterior abdominal wall, he will point there and tell. Whereas for a gastritis, he will point all over the upper abdomen. So this is the idea. Afferents from the visceral peritoneum are represented well in the sensory cortex is not true. It will be diffusely represented in the sensory cortex. Whereas afferents from the parietal peritoneum and the anterior abdominal wall will be well represented. So what is true? This answer is true. So the true answer is this. With the explanation why this is not true, what exactly is happening, why it's not true, I have explained in all the other options. Now, the sensory level at the arrow, that is the umbilicus, is, there's nothing much to conceptualize. It is T10. You can make out here, it is T10. There is no concepts there. The root level of ilioinguinal nerve, ilioinguinal and hypogastric nerves, hypogastric and ilioinguinal nerves, what is the root value? It is L1. Again, nothing much to conceptualize. It is a pure recall question. So the answer would be L1. Fine. You can make out it's the same thing here. Answer would be L1. Now we have an important clinical question here. I do not have that particular video slide, but I will show you. Loss of liver dullness is present in all of the following except. The point is, what exactly is liver dullness? Then you will know what is loss of liver dullness. Let's have a look. Say you keep on percussing from here and coming. At one point, you will find dullness setting in and it will continue down. So that dullness may be at about the 5th space. You might find dullness starting from here. You are percussing from here. You're getting resonance because lung is here. Resonance, resonance, resonance. Then you start getting the liver dullness. This is normal. When a viscera is perforated in the abdomen, there will be lot of gas under the diaphragm. It will insinuate between the diaphragm and the liver. That is free gas under the diaphragm. So what will happen? There will be lot of free gas here. Let's have a look. We can put this as a marker. See? Lot of free gas will be here. And then again your liver will start here. Your liver will get pushed down. So this free gas is actually acting like in continuity with the lungs. So whenever there is free gas and you keep on percussing, you'll get resonance, resonance, resonance. Instead of getting dullness here, you will get dullness lower down in the 6th or even the 7th space. So that is loss of liver dullness. Now, where all can it occur? Can it occur in any perforation of involving a hollow viscus which has air inside? But your question is except. Duodenal ulcer perforation, yes. Gastric ulcer perforation, yes, it can occur. Small bowel perforation, yes, it can occur. But it cannot occur in an appendicular perforation. It does not happen in an appendicular perforation. Why? Because, let's see, this is your cecum. You have the IC valve here. And then you have an appendix here. Fine. Your appendix lumen will have maximum 1 milliliter of air or 1 cc of air. Appendix will have only 1 cc of air. Now, this IC junction will be always patent. Most of the individuals will be patent. Cecal air cannot come in easily. So whatever wants to go into the peritoneum will be this 1 cc of air. And that is very less to obliterate the liver dullness. That is why in appendicular perforation, don't expect obliteration of liver dullness, and don't expect free gas under the diaphragm, unlike a duodenal ulcer, gastric perforation, or a small bowel perforation. So coming to the end of the presentation, thank you very much. I discussed only 4 questions, but those 4 questions should not be learnt by rote. And I'm happy students have sent this to me because there's a lot of explanation behind, and you will mark the right answer when you have the explanation available with you. So please keep sending these questions. Pure recall questions, I just put up the diagram and made it a little more emphasized. But the ones which needed concept, I was able to put it up in graphics. Thank you very much. Please do keep posting these questions which need some sort of conceptual clearing. And I'm very happy with the students who have shared these questions. And as usual, I will ask you to share, like, and subscribe, and join my Telegram channel too. Thank you again.